Hi, my name is Christy. I had neck fusion surgery about a week ago, and I'm just adding in my little 2 cents about my surgery. I had C4 and 5 and C6 and 7. So my incision goes this way instead of this way. Um, at first, I looked on YouTube and found a whole bunch of different videos to see what was going to happen. I'm not the tallest person in the world, nor am I the smallest person in the world. So when they said take a bone out of your hip, I thought it was going to come from my hip, but they took it from my pelvis instead, which is a tad bit painful, to say the least. The incision is very hard, just like this one. It's hard. It's not as hot as it was before. But I'm going to touch on some of the things that happened during the last week, um, so that maybe it can help somebody else. I had surgery on Monday, um, and pretty much drugged up after surgery. My throat was sore, of course. It still is. Um, they try to wake you up every so often to see if you want to eat and see if you want to get up, move around, have to go to the bathroom, anything like that. Really, I didn't want to. Like I said, it still hurts. Sneezing hurts, burping hurts. It just feels like there's a glob of mucus stuck on the top of my throat. Um, the most that I remember is the respiratory person coming in, and he brought this, and he said you have to breathe in it at least 10 times and get it up to 1500, which is where the little marker thing is. And he wouldn't leave until I got it up to 1500. So that was fun and interesting. Day 2, they brought me some food, tried to see if I could eat. I had a normal breakfast. It was eggs and bacon, and I think like some French toast or something. They brought me some coffee and some juice. They tried to give me a normal diet, but that didn't work, because after that they gave me my medication. I was still on the IV. They gave me my medication, and shortly after I was sick. They didn't give me the nausea medicine first. So they, cleaned me up, got me all better, tried to get me to walk around a little bit. So the physical therapist came by, and she showed me how to go up and down stairs. She came with a walker, and I have one, so that she could see what my limitations were, which was good, because the first couple of days you are kind of still drugged up, and they keep you on an IV drip so that you constantly have medication. The only annoying thing was that they know you can't talk, or that it's at least hard to talk when you push your call button. So when you ask for someone like your nurse or whoever, it's hard to say who you want. So just know that the first couple of days is going to hurt. You're not going to be able to talk. I just got my voice back maybe 2 days ago. When I came home, my kids were here. I had a whistle to blow. So if I needed to get up and go to the bathroom, or if I wanted some water or anything, they could bring it to me. I was stuck on the couch behind me. I had a whole mountain of pillows and blankets propping me up. Not the most comfortable position to sleep in, especially when you have this thing on your pelvis. Um, it makes it even harder because you have to get up. After about a week, I decided to get off the couch and get into my bed. And the only thing was that I needed help getting up and down. And all of this right here was strained because I had to pull myself up out of bed. So basically, I propped myself up on a bunch of pillows. I tried to put something in this section, a rolled up towel or something, so that it would take some of the pressure off. I finally went to the store and bought a mini pillow pet because, of course, they're folded and they're rounded. Um, and they fit perfectly in that space. So it takes off a lot of the pressure. So definitely get you a mini pillow pet. They are helpful. No matter how childish they look, they are extremely helpful. Um, so that was the funness of it. I still couldn't eat. So I was eating icy popsicles and water and still taking my medication. Um, Pretty much for the whole week. That's for a whole week and a half. That's what it was. Wasn't really, I was able to get around with the walker, hold on to the walls, that kind of thing. I wanted food, looking at the commercials, but couldn't eat anything. So it's frustrating. I definitely know I have lost some weight through this. Um, let's see. You are going to need help for at least 2 weeks. At least. You're going to need somebody to help you get up off the bed or off the couch, just to go to the bathroom or to walk around, um, just to do little stuff because you're not going to be able to stand up for too long. The pain and the pressure on your scar is going to be intense, so you don't want to do that, and you don't want to risk tearing anything and opening up the wound again, causing infection. When I was in the hospital, they gave me a flu shot, and then I came home on Tuesday. Wednesday, I was at home. I was pretty good. I was home by myself, and Thursday, I woke up and I was extremely hot. I took my temperature and it was 101.2. Went to the hospital, found out I had pneumonia. So Thursday and Friday, I was in the hospital. I went home Friday evening and was here Saturday. So definitely keep that in mind during the winter if you're going to have your surgery, that they will give you the flu shot. So, you know, you just want to keep that in mind. I was dressed warm, but apparently that just, it did what it did. You will have a lot of mucus. Your nose will be stopped up. For the first probably 4 days, it was really bloody mucus that was stopping up my nose. I couldn't really blow it because it hurt here to blow my nose. So basically, just roll up the tissue and stick it up there and roll it around and pull it out and whatever comes out, to clean it as much as you can. My doctor told me to wait a few days before I could take a shower. And of course, the day that I was planning on taking a shower, I was back in the hospital. And when I got to the hospital, they still wouldn't let me take a shower, even though I had one in my room. I guess they were trying to protect themselves more or less. But I did get to wash up, which was good. Another thing that you'll need besides the walker and the pillow pet and the Nextcare is a portable potty, because you might not be able to make it to the bathroom. You really, really might not be able to make it wherever your bathroom is, whether it's 10 feet away or whether it's 2 feet away. Sometimes you might not make it. If you're a woman, you might want to try poise pads. They help with the leakage and all that stuff. Or maybe an adult diaper, just for those accidents that may occur. And like I said, taking a shower. Fortunately, I've been able to take a shower, so standing up wasn't too bad. Getting rid of all the gunk that was on me from all the other bandages and the tape and everything, that's what is the hardest thing to do. So you might want to think about getting you a shower seat of some kind, so that if you still feel kind of wonky, that you could sit down and take a shower. Make sure that you take your medications. My pain was so bad that I was taking 2 of my pain medications at a time. So I would take 2 hydrocodone at one time so that it wouldn't wear off as quick. My sleeping patterns were sleeping about maybe 3 to 4 hours at a time. So if I went to bed at 9 o'clock, I would sleep till about 12 or 1, get up, take my medication, be up for maybe an hour or 2 until my medication kicked in, and then be asleep for another 4 hours. That was my day for an entire week and a half. Now it's kind of getting back to normal, to where I still sleep maybe 5 or 6 hours now at a time, but I'm up a lot longer. So something else to keep in mind. My doctor didn't send me home with a collar. I know I watched a lot of videos where people had C-collars on, the hard ones and the soft ones. Some people had one that you could take a shower in. My doctor didn't send me home with any of that. He said most people are annoyed by it, and I understand why. I have a soft neck brace, and it pulls because it's all up here, so it pulls everything. And with me being swollen, you still can't get it in the right position or place in order for it to work properly. And it strains everything, so you still can't get comfortable. Which was always the fun part in trying to sleep and eat. Make sure you get straws, because you will definitely not drink anything from a glass or a cup. One thing that did help me in the sore throat, because they gave me liquid lidocaine to try to help the throat, and so that I wouldn't feel a whole lot trying to swallow pills and everything, because they do give you pills. They do not give you liquid versions of anything, which is kind of crazy, but they don't. So the liquid lidocaine helped, and hot water, lemon, and honey. No tea, just the hot water, lemon juice, and honey. That helped an immense amount with the sore throat and the healing. It allowed me to actually be able to drink something else that was soothing. It is very, very hard to go from eating food, quote unquote, your last meal, to eating absolutely nothing except drinking water. I kind of prepared myself because I knew I was not going to be eating. So I stocked my fridge with a lot of ices and push pops and popsicles, things of that nature. When I finally got able to stand up, um, which was, I think, maybe Monday or Tuesday, I rolled myself into the kitchen and used my Ninja blender, and fixed me a somewhat smoothie so that it was cold and I could eat it with a spoon or I could suck it with a straw. So that was great. The first thing I used to my Ninja 4. So that was two experiences in once. Um, right up under here, from about here all the way over to about here and down, um, is numb. So I can feel this just a little bit, but see, like right here, I can feel it, but I can't. I guess that's part of the surgery. And I have, like, of course, my scar is hard, but closer to this side, there's a lump that's next to my throat. Over here, I'm good until I get about right here. So the pain is right here. And then, as I said earlier, I feel like there's like a giant lump of mucus that's sitting on top of my throat and I can't swallow it. And I felt like that since the surgery. I don't know how long it's going to take for it to actually work, to stop feeling like that. It's kind of like when you make yourself burp and you force air down. Well, that air is still stuck, which is really interesting. It's a different kind of feeling. Um, when people tell you that it hurts, it hurts. Just make sure that you have a lot of numbing stuff with you. The liquid lidocaine, make sure you take your medications. That's why I said you needed somebody to be with you, because if you take your medications, if you're supposed to take them every 6 hours or every 8 hours, make sure you have somebody there to wake you up so that you can take them, because the pain medications are the most that you need. If nothing else, you definitely need um, your pain medications. So far, my doctor gave me vitamin D that I have to take every week, and then I have calcium, and I have my pain medications, and I have my nausea medication. Um, but I also have um, stuff from the hospital since I had pneumonia, so I have to take that as well. Just make sure that you stay inside, stay warm if it's during the winter time. I don't know what I was thinking, um, having the surgery done a week before Thanksgiving, but it was still good. Uh, Yesterday, I was able to eat a pork chop. Um, of course, I had to cut it up really small, and it took me forever to eat, but just to have actual food is a good thing. Um, I guess that's probably it. Just make sure that you don't play with your wound site, because when they took the drain out, um, because every few hours they came in to empty it and everything. But they took the drain out and they put a big piece of gauze over it. Um, and then right before I left, they took that off and put a smaller piece of gauze and tape and everything. So it was pulling all of this down. Um, You don't know me, but my face is swollen still. My neck is still a little swollen. So, um, it's very interesting to have. I mean, I feel it and it hurts a little bit, but I think the most pain is from swallowing. Uh, Things that hurt, swallowing hurts, sneezing definitely hurts, coughing, which is what they encourage you to do after your surgery. They encourage you to cough so that you can kind of cough some of the phlegm and gunk up. Um, I could never cough anything up, but it did help a little bit. Um, Pretty much if you're going to try to eat anything, it hurts because it's like you're trying to squeeze a football through a pinhole. So I suggest that you wait 2 weeks before you do anything. Um, I can get around my house, um, if I hold on to the walls and things of that nature. When I go outside, I make sure I take my walker. The first day that I actually went outside, because I was tired of being cooped up in the house, I just, put on a coat and made sure that everything was covered up and, ventured outside. It took me a minute, but I ventured outside and went and got the mail, and then came back in the house. That was my excitement for the day. Pretty much that's all that I could do. But I've since been to the grocery store and to, just little places, trying not to be sedentary and stay in the house. I don't have a really big house, and so there's not too many places for me to walk back and forth. Um, I have stairs in front of my house, so um, that's pretty much as much exercise as I get, walking around the house and going up and down the stairs if I decide to go outside. Um, so my appointment is on the 3rd, and I'm hoping that that's when my doctor tells me I can do regular stuff like drive, because I definitely miss driving. Um, and then on the following Sunday, I'm going to venture to church, which I hope is going to be good. So, those are my little tidbits of wisdom. You might want to try, if you like things to suck on, I got some Cheeto Puffs because they kind of dissolve when you eat them. They're great if you want some semblance of feeling like you're eating food. Um, so that was great. I also have my gummy bears. They were frozen. It was a 5-pound bag, and you just put them in the freezer, and then every once in a while you take them out, and it's comforting to your throat because it's cold, and then eventually when they warm up, you just chew them up and they slide down. So um, it helps a whole lot. I'm going to stand up so I can somewhat show you where my scar is on my pelvis. Um, and then I guess I will release you. So, standing up is hard. So, I have rolling chairs. My incision site is right here. Um, and it's about this big. And I just took the bandage off of here and put one of these on, one of the neck scares, because it was really gross and it felt icky. Since I'm heavy set and couldn't wash for a couple of days, and with this being what it is, there was a rash that started right up under my stomach. Um, and so, of course, that had to be washed, and it kind of got really raw. So I just put some powder on it and dried it out, and that kind of took care of it. Things I haven't been able to do is shave my underarms or anything. I can't really lift my arms that much. I can lift them. My favorite thing to do is put on a hat, and it's really hard for me to put my hands above my head to do that. Before the surgery, I could move them a little bit more. Um, what they did was they took the bone from my pelvis and put it in C4 and 5. And then they took the metal plate that you've seen in most surgeries and put it on 6 and 7. So hopefully this helps you. Hopefully you like it. And thanks for your time.